Here there is, we are going to look about the OBG Neet Pg 2025 today's recall thing. There was a question regarding previous C-section, bradycardia, there is impending rupture, all time repeated question, there is emergency C-section, magnesium, this thing. The loading dose is about 14 gram. Always, it's a very important topic. And this umbilical cord prolapse, what do you do? That is push up, retrograde filling of the bladder, shoulder dystocia, again sequence, all time favorite. That first one is Meg Roberts, another last one is a Sanavelli, and in between that procedure is there. In one, I think one option is being shown, this Meg Roberts thing, and the last one is Sanavelli. And amniotic band syndrome, that is a Streeter syndrome, there was a question. And sequence repair of episiotomy, that is vaginal mucosa, perineal muscle to the skin. ECV, all-time favorite question, that fetal distress, what do you do? That is ECV, all-time favorite. Rotate the baby to the original position, C-section. And I think someone said that there is ECV contraindication was being asked, that we need to check. The Lovset's manual was being asked, extended arm delivery. Control cord traction, one question was there. And prevention, how do you prevent this thrombosis? BMI more than 35. That is always lower molecular weight heparin is a drug. So in that prolapse thing, what is what ligament? There is a cardinal ligament, or this also known as McNaughton's, and also this transverse thing. And other question, day 21 to 25, the hormone thing, that one question where the LH and FSH will be low there. Another one question, premature ovarian failure, one question where the LH, FSH high up, shoot up, and AMH value comes down. That heavy bleeding, one question, that is MRI picture being shown, that is adenomyosis. I have already put in radio also. Hydronephrosis, all-time favorite, one question, all-time they used to ask, every time we have said that this is going to be the repeated thing. What is the stage? That is stage 3B, because it involves the pelvic wall. Another one, serous adenoma carcinoma, there were one question, that endometrial biopsy thing. That's umbilical cord, that you will be knowing that 2 artery and 1 vein. I think something related to there was, I didn't got that exact question. The pap smear, that voila, the TDF thing, when do you terminate? There was a question, that thing, that that's 32 weeks. Another question I got it about that toxoplasmosis, voila, that IgG positive, reassurance will be done. And NST also one question, that is one acceleration that you look for like 20 minutes, then we will extend that NST, that is for another 20 minutes. So 40 minutes, that will be continue, we'll be doing that. That's another question, Shadow's thing, yeah, that was been asked, like presumptive thing, that will be continuing this. And irregular cycle, voila, one question where there, that 2-month amenorrhea, that is the single best is crown rump length, CRL. Another question, there was a 65-year-old hysterectomy specimen was being shown. That's about this endometrial carcinoma, that's balloon tamponade will be the management here. And iron and folic acid, there was a question, I'm not sure. Please, if you got like this, please do it. So as a whole about this OBG recall, what I really want to say is that OBG, these are all the previous year, like repeated answers, this previous year topics, and all-time favorite. Every time, so many in my important things also, I have been said that this manuals and all-time favorite it was actually easy. Like previously also I have said that OBG and surgery should be in fingerprints, and this time fingertips, sorry, and this time this OBG was really easy. OBG gyna part is very easy. I think sometimes it's not been sure, but sometimes if there's many questions being so easy, then there is a chance for raising the cutoff. Don't be panicked, maybe sometimes. Yes, we can always hope for the best. Let everyone get your dream branch actually.